In many cultures, including here in Germany, trauma and mental health issues are still being stigmatized. There's a lot of stigma, there are a lot of stereotypes attached to this, and there are a lot of preconceived notions about mental illness. Trauma is a #1 driver for conflict and a #1 barrier to integration. At RESOLUTE, we thus seek to empower individuals and inform them about mental health, to break down stereotypes, reduce the stigma that is still attached to mental health issues, and foster a mutual platform of trust where these issues can be raised, discussed, and adequately dealt with.
We don't come in as experts that want to solve conflict and want to explain trauma, but rather we want to, equip people with the skill set to recognize trauma, but also to recognize conflict and deal with it.
One very impactful experience I had was when we were doing a workshop on trauma and mental health awareness. We were showing a video by the Max Planck Society that portrayed the issues and the symptoms that you can experience if you had been exposed to a traumatic experience. And after the session, we had a lot of refugees walk up to us and tell us that for the first time they could genuinely relate what was being displayed in the video back to their own symptoms they had experienced, and that they couldn't really attribute to anything. And so for the first time, they had the sense of, okay, there's somebody out there that I can relate to, that understands what I'm going through. And so as a consequence, a lot of refugees opened up to us, and when we were providing them with the local support structures for mental health counseling that are available in Berlin, we saw that many of them actually wrote down this information and were genuinely interested in making the first step of having this awareness that they have an issue with their mental health presently, and that this can be dealt with, and that this is something that is treatable.
That's an important question, because there are actually a variety of misconceptions, and the first one is that trauma equals a psychological or psychiatric condition. So often people mix up trauma, which is actually defined as a traumatic event, and things like or psychiatric conditions like post-traumatic stress disorder, PTSD, or other consequences like, let's say, depression or different kinds of anxiety disorders. In fact, people actually might grow stronger by surviving a traumatic event. So there's an effect called post-traumatic growth, which means that people grow stronger by, for example, having a closer relationship to their spirituality, to their friends, to their family, by surviving potentially traumatic events. But it's true that the likelihood to develop something like post-traumatic stress disorder is much higher in refugees than in people still living in their home countries. There are actually more or less 3 phases, 3 episodes where refugees are endangered to develop post-traumatic stress disorder as a consequence of surviving a traumatic event. So often it's a combination of those 3 episodes, which is, first of all, yes, the situation in the home country, but then also during the flight, which is often a very stressful and very terrifying phase, while you might encounter other parts of abuse, of violence, and then, which is also very important, often not very often mentioned, is the situation in the new country. So let's say in Germany. You would face, bureaucracy, but then also often outright discrimination, hostility, and all of that without your social environment, without the people who would usually give you strength. So you have those 3 episodes, and all of that constitutes a big risk for developing PTSD or other related disorders. So, how we behave in conflicts is related to our mood, and mental health conditions change our focus. For example, when you're depressed, you might end up focusing more on the bad news, and you might end up feeling more easily offended. With PTSD, you might overreact because you feel threatened. And it's important to know that. And with a lack of mental health awareness, and that's why we care so much about that topic, you might end up in difficulties in two ways. If you're not affected by a condition and you don't know about these conditions, and so there's a lack of mental health awareness, you end up not being patient enough and engaging in a conflict too easily, and that leads to an escalation. And then on the other hand, when you are depressed, for example, as a result of surviving a traumatic event, when you suffer from PTSD, and you don't know how complex all of that is, and you don't have to blame yourself, then you might end up withdrawing from society. You might end up trying to avoid other people, feeling ashamed, and that in itself is a vicious cycle. So I think as a society, we need to address that societal stigma, because in the end, the two groups, those who are affected and those who are not affected, would benefit. So there are several things you can do, and the most important thing is don't try too hard, don't pressure, don't diagnose, but be a good listener, be a good person, and be patient. Because people want to share their experiences. They don't want to be put into categories, and even when somebody doesn't accept a diagnosis, they like to be heard, and they like to have a conversation about those things at some point, not in the beginning. So don't pressure, be patient. And then you may want to check for mental health professionals, to care providers, and just to make sure that you have their contacts, their addresses. And then when somebody close to you realizes that they have such a condition and they need help, you might be in a position to actually, in a very patient manner, to offer help and to establish a contact to such a professional care provider.